Assalamu alaikum. Today we will discuss about ABG sampling. We will discuss how and when to do ABG sampling. Its complications, its contraindications, its indication, and its suitable sites for sampling, and its procedure, its way of purpose. Each and everything we will discuss in this video. So we will start our video. ABG sampling, how and when to do ABG sampling, and with the help of ABG sampling, we get to know about oxygenation status of patient, ventilation status, acid base balance, uh, oxygenation, ventilation, acid base balance, ventilation, acid base balance. Before taking ABG sample, you should properly take consent from patient, explain his attendant about his indications. In indications, you should explain why it is needed. Okay, indications, why it is needed due to respiratory pathology. What kind of respiratory pathology? It may be hypoxic or hypercapnic respiratory failure, hypoxemic or hypoxemic type 1 failure, and hypercapnic type 2 failure, hypercapnic failure. You should know about hypoxemic and hypercapnic respiratory failure with the help of ABGs. Carbon dioxide narcosis, COPD, pneumonia, or it may be metabolic causes, metabolic related to renal issues. Okay, acute kidney infection, uh, chronic kidney disease, or loss of bicarb, metabolic acidosis, in metabolic acidosis, DKA, diabetes ketoacidosis are poisoning. You should explain patient or her attendant about its complications during procedure. Complications like infection or hematoma, bruise, gangrene, or ischemic issues. And its contraindications like local infection, local infection, peripheral vascular diseases, or AV fistula. It may be coagulopathy. And its proper sites for sampling like radial artery, its most suitable site because it's superficial artery, brachial artery, femoral artery, or dorsalis pedis artery. most suitable site is radial artery. Before ABG sampling, arterial cannulation and modified Allen's test, patient you should explain patient about the modified Allen's test. You should ask the patient in modified Allen's test. Allen's test. You should ask the patient raise the limb and clench the fist, like just like this. Clench the fist. Okay. Occlude. You should occlude both the radial artery and ulnar artery. Okay. Simultaneously, then ask to open up the fist. Firstly, you should occlude both the radial and ulnar artery. Then you should occlude both the ulnar and radial artery simultaneously, then ask to open up the fist. Okay. You should see the you can see planching over the fingers tips and the palm. Then release pressure from the firstly you should release pressure from the ulnar, then at the radial side. When you release pressure from the ulnar artery, you can see return if no return of the color within 5 to 10 seconds, considered as an abnormal. But if return of the colors, red color, like red color or pink color, it means it's normal. Okay. But if no return of color within 5 to 10 minutes, considered it as abnormal, modified Allen's test. Not safe to cannulate the radial artery or to take ABG sample from the radial artery. Okay. Its procedure: arrange all the equipments, its procedure. Arrange all the equipments like gloves, disinfectants, skin disinfectant, alcohol swab, gauze, pieces, and 2% lignocaine, local anesthetic, pre-heparinized syringe, and 26 gauze needle. You should palpate the radial artery at thumb side. Okay. You should palpate the radial artery using 2 or 3 fingers and see the course of the radial artery as well. Extend the wrist using the normal saline bottle, etc. Clean the site with the help of alcohol swab, and then clean the site in circular manner with alcohol swab or skin disinfectant. Infiltrate local anesthesia before cannulation. You should infiltrate the local anesthesia. Before infiltrate, aspirate then infiltrate. Palpate the radial artery and having pre-heparinized syringe on another hand, then go at 45-degree angle. Discard the needle and remove air from the syringe. After performing test, okay, focused. Okay, then discard needle and remove air from syringe. After performing test, you need to occlude site from where you have to take the sample, like at this side you have to take the sample. Then occlude site from where from here. Okay, 3 to 5 minutes occluded site. 3 to 5 minutes occluded site. Okay. Coagulopathy cases occluded 5 to 10 minutes. Post procedure, you should set sample as soon as possible. Store it at 0 degree, because RBCs consume oxygen and increase the partial pressure of the carbon dioxide, decrease the partial pressure of the oxygen, and give it a false reading. Okay, remove heparin from the syringe, others it will dilute and give you false reading. Remove air bubbles from the syringe because it has more oxygen from the environment and less carbon dioxide, and then which shows more partial pressure of oxygen and then the less partial pressure of the carbon dioxide. So it is all about the abgs, and it's post procedure, it's post procedure, and its equipment is post procedure, its procedure, its suitable sites, all about it we will discuss. Thank you very much.